So why low value care? And many of you say, I wanted to be remembered as a person who made high value care accessible and affordable. And, as a small role in the value-based insurance design portion of the ACA that has removed consumer cost sharing now for over 80 high value preventive services, does suggest the very important point that we want to make, that healthcare is typically paid for in two portions. I call the entire healthcare cost an iceberg. What my patients pay is the tip of the iceberg, and what other payers pay is the below the waterline. And you can see by the next slide, very importantly, what patients pay is determined by their insurance coverage. So while all of you on the phone are typically trying to look at the total iceberg part, Americans tend to care only about the tip of the iceberg, since that my patients who get their no-cost pap smear, mammography, colonoscopy, LDL screening, hepatitis C screening, they don't care or ask about how much the test costs. They're just very, very happy to know that their coverage allows them to pay very little. The next slide will show you that in the situation now, many Americans and several of my patients are in the deductible portion of their high deductible health plan. It's very important to know that patients are now paying the entire iceberg cost. And in some situations, they're actually paying more than their health plan pays because of arrangements that often come with negotiations with third-party payers. Next slide, please. So we want to get to the situation where patients will pay little for high-value care. And I know every payer on the line now is just saying, Mark, you've been talking about this for so long. This is a webinar on low-value care. How does this relate to VBID? And what you'll tell me is that I try to extend lower cost sharing for high-value services. In the situation, the water line will rise. That means the third-party payer has to pay more. Next slide. Where are we going to get that money? So sticking with the low value care and high value care iceberg scenario, imagine that we have two icebergs, high value care icebergs and low value care icebergs. At current amounts, patients are being faced with equal amounts of cost sharing independent of the value of their care. And what I would like those of you on the webinar to understand, that if we were to melt exclusively the low value care iceberg, next slide, as the low value care iceberg shrinks, the water level allowing you to cover high value care more generously can actually occur. So this is what we call headroom. By the identification, measurement, and removal of low value care, we could hopefully take some of those billions of dollars of savings that Michael talked about and not just remove them from the system, but hopefully incrementally apply them to more generous coverage for high value care.